For more on the Texas abortion law, let's bring in someone who is seeing this firsthand, the effects right now on the ground. Kristina Tocce, Dr. Kristina Tocce, Vice President and Medical Director of Planned Parenthood of the Rocky Mountains. Doctor, thank you so much for joining us tonight.
Thank you for having me.
So you are in New Mexico and say you're already seeing an uptick in patients from Texas seeking abortion services there. Tell us about that and what else these women are telling you.
So our affiliate covers Colorado, New Mexico, and Southern Nevada, and we have definitely seen an increase in call volume. There's going to be clearly an increased need for, there's no end in sight at this point. And we had a preview of this with the COVID pandemic during the shutdowns when the governor of Texas basically eliminated abortion access. And we saw a 12-fold increase in patients at that time traveling from Texas. So we have been preparing for this. We continue to prepare because we need to assure that patients can get the care they need. The stories that I hear as a provider, things I never thought I would see in my career, things that my previous teachers told me about their pre-Roe experience in this country, but nothing I thought I would experience in 2021 here in the United States.
Last night, we spoke to a Texas state senator who actually worked on the abortion bill. She said this wasn't about criminalizing anything and suggested it wasn't even about targeting the pregnant women themselves, just the abortion providers. What are your thoughts on that?
I think that this bill is a blatant attack on the practice of medicine. Abortion providers are caring, skilled, compassionate medical providers. And I don't know what else to say to that.
Let's talk for a minute about the challenges of having to travel for hours to get abortion care in a different state, especially if money is tight.
Yeah, that is, I will speak on behalf of myself and all the wonderful individuals I work with every day in our healthcare setting. And patients have to go through such tremendous length planning their childcare, their coverage at work, their travel during a pandemic and trying to be safe. And these are heart-wrenching stories that are, again, medically unacceptable. Abortion care is basic medical care, and no one should have to experience these hardships to access that care. And so we hear these stories, we see this every day. And on the flip side, we worry equally about the patients we are not seeing. This definitely will impact disproportionately people of color, those of lower socioeconomic status, and people living in rural areas that already are remote from care sometimes. So as much as we are striving to care for each and every patient that can come to us, we have just as much worry and concern, and I'm tremendously scared about the patients that are not able to reach us.
Doctor, I want to get your thoughts on, for many, what is one of the most stunning parts of this bill. Other restrictive abortion laws have had exceptions for rape and incest, not this one. Is there any thought here in this law at all for the physical and mental well-being of women seeking an abortion? And if not, why?
Hearing you ask that question almost takes my breath away, because I, too, cannot fathom that this has come to be. No exceptions at all. That is just, I don't even know what to say as a provider who has taken care of sexual assault survivors for 20 years. To say to someone, you cannot have an abortion, you are forced to carry this pregnancy and deliver, that is just cruel, inhumane. I don't even have words to describe that.
Dr. Kristina Tocce, a lot of people feeling that weight, and I thank you very much for taking the time.
Well, thank you again for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.